Hey, I'm Dr. Dudum. I'm going to break down the 5 biggest questions and concerns to get over disc injury with spinal decompression. Why am I talking about it? Because I fixed my back 5 years ago with spinal decompression, and now I'm going to answer your questions, why and how. So number 1, how does it even work? How do these unicorn tables work? We have a bone, we have a herniated disc, and then we have a bone, and there's the soft, tiny nerve. How decompression works is we're gonna angle the table, and we're gonna pull and oscillate. When we pull and oscillate, it changes the disc pressure, the pressure inside the disc, and it allows more blood supply, more nutrients, oxygen. It decreases inflammation. All of this is designed to get that disc to reabsorb and free the nerve to help alleviate nerve pain and sciatica. Number 2, is it safe? Is decompression safe? Hey guys, there's 3 main things that you would not want to do decompression. Number 1, if you're pregnant. Number 2, if you had a recent fall and you have a fractured vertebra, that would be a no-no. And number 3, if there's any tumor or infection, something going on inside your spine that's causing your pain. Those are the 3 main things. Okay, number 3, is it gonna hurt? The main thing with decompression, when we pull like this and oscillate, we don't just yank you apart. That could potentially injure you or cause a really bad flare-up of your symptoms. We gently pull and oscillate like this, and that helps decrease a spasm from the paraspinal muscles, okay? So it's a safe way to do it. It prevents spasms, and it's a very effective way to get that disc to reabsorb. Number 4, there's no way that disc can reabsorb and actually reduce the pain of the sciatica. Yes. Check out these results of these patients. We have a 45% reabsorption of a disc injury just 4 months after treatment. We have a 47% reabsorption of the disc injury after treatment. We have a 29% reabsorption of the disc after treatment. We even have a 78% reduction of an extruded disc after treatment. So yes, pre and post MRI absolutely shows that it works. Number 4, what about traction? Should I start traction or an inversion table? What's the difference? Those can be great things to try for a disc injury or a lower back. However, they're very non-specific. So an inversion table, you're gonna lay flat, 30, 45. You can pick an angle of 15 degrees or so, depending on the manufacturer. But you're just hanging based on your weight and gravity. There's no specific amount of weight you're pulling with, and there's no specific amount of angulation. And lastly, there's no oscillation. The oscillation is key. When we angle and we don't just pull, because when you pull, that's traction. It helps alleviate pressure. What we want to do is we want to angle, we want to pull, and we want to oscillate back and forth. When it oscillates, that changes the intradiscal pressure. That's the difference between mechanical traction and spinal decompression, the oscillation cycles. And I can change the oscillation cycles. The oscillation cycles can go from 50% and they can go to 10%. It's based on the practitioner and the patient's needs. Okay? And lastly, okay, where's the research? The doctors don't prescribe it. No one, because there's no research. It's never been done. There's research dating back to 2007 that shows the pain reduced, sciatica reduced, and there was a less need for spinal surgery. There's even a study 15 years later in 2022 that had 60 patients. 30 of those patients had decompression, but they got set up and they did not get treatment. So it was they call it a sham treatment, like it was a placebo or a sugar pill. Then we've got another 30 patients that had actual spinal decompression. 8 weeks later, from 8 weeks, the 30 patients that had actual decompression, they did a pre and post MRI, because that's how you would check for a disc herniation or a disc lesion. Those patients had significant reduction in pain and sciatica. They had an increased height of the disc. And lastly, the disc reabsorbed, and it was actually a smaller disc lesion after decompression. So there's a ton of research out there. These are the 5 biggest questions. If you've got a question that I did not answer, comment below or shoot me a message. I'm Dr. Dudum. I specialize in spinal decompression, and I absolutely help patients every day with spinal decompression. Hope to hear from you soon.